Good afternoon, everyone, and welcome to the Health Science Talk. Today, we're going to be having Mr. Malak Halawy. Mr. Malak Halawy is a healthcare management professional with a robust background in healthcare policy, operations, and AI-driven transformation, holding a Master's of Public Health from our Faculty of Health Sciences at the American University of Beirut, and certification in AI implementation in healthcare from Harvard University. Mr. Halawy had led numerous critical management positions across the Middle East, including Beirut, Kuwait, and the UAE. With extensive experience in operations, optimization, strategic development, and AI automation in healthcare settings, Mr. Halawy has successfully guided organizations towards sustainable growth. He has also written several articles on hospital management, cost efficiency, and healthcare evolving landscape, as well as his book, 100 AI Applications in Hospitals, a practical guide to revolutionizing healthcare operations, which reached number 5 on Amazon best-selling list in category of hospital administration. Mr. Malak's mission is to reshape healthcare through first principle thinking, technology integration, and strategic innovation. Mr. Malak, the floor is yours. Thank you so much.
Thank you for the lovely introduction. Hello all, and I thank you for taking off your busy schedules and attending this session. I hope it can present some value to you. My talk is called to AI or not to AI, a public health perspective. Let's begin with the show of hands. Who thinks we should AI? Okay, that's encouraging. Okay, who thinks we should not AI? Okay, a few people didn't even raise their hands both ways, but I hope this talk could shed some light. Yeah, you're right. Having this talk here in the amphitheater is really brings up a lot of memories. I do remember, should I say the years, 25 years ago, around that time, I was sitting in the same place, the same seats, in the same room, and actually thinking, what will be the next big thing? What will really change healthcare? And how it's going to be dictated after 10, 20 years? And I had different visions. I had different things that we were learning. I used to be a medical lab student, so that's where it all began. And I was more affected by what we were learning in microbiology and immunology and these stuff. And at that time, for those who remember, it was like genetics was like something so new, virology and microbiology. And I really thought virology was the thing. I thought that the viruses, the human genius will be able to manipulate them enough that the virus can go everywhere across the body. They can reach any place. They can use their DNA that's manipulated by humans, dictate them to change the things, a lot of things in the homeostasis of the body. They can go to the pancreas to treat diabetes, go to the stem cells and the bone marrow, and even they can go to fix some hereditary diseases that we thought that they would never change. And I was so dedicated to this point. I wanted even to continue my master's in virology for some time. I really considered that. And I really thought that this little organism, now it's called, I think, living agent, is gonna be the future of healthcare, where we're gonna be able to put something on this little strand of DNA and get it anywhere across the body and fix things in the human. And this will revolutionize healthcare. It's gonna change how medicine is being educated and how it's being practiced. And this is the future of healthcare. Fast forward to the 2020s, and virus was in the headlines, but for very different reasons. It was the villain in the story. It made us sit at home, a lot of casualties, unfortunately, and the pandemic happened. The clicker, حطيته بجيبتي. Okay, tend to do these things. So the next big thing was not virology, was not viruses, and it taught me one thing, that we may not be able to predict or forecast the health trends properly. We may not be able to know what will be the good thing or the bad thing that will dictate how we do and how we practice healthcare. But we definitely should be equipped. We should be ready. We should be ready to adopt any new thing, a new technology that comes our way. And from this line of thinking, I want to introduce AI, which is the title of my talk. I think that there's enough evidence now that AI is here to stay, that it's a very important technology that we cannot ignore. And that prompts the question, where did it start and how it become the main headlines in most of the industries around the world. So I'll just go a brief little history about AI. So there's AI really, it's just when something new happens, we always kind of find it was there 60 years ago, and it applies also to AI. So it was there in the 60s, in the early 60s, it started there. It was very minimal. It was very complicated. It needed huge computing power, and it was very limited to a certain clinical decision making in a very defined, highly tech, highly specialized places. It wasn't until the 90s that machine learning started to gain some momentum and really serious funding and research started to happen there. In the 2010, in the 2000s and 2010s, there where we started to see the benefit or the fruit of AI. And some important articles started to come up in very major journals. You can see, I'll just go talk about them a little bit. In 2016, 2018, it's the same study about diabetic retinopathy happened from two different groups in two different places, and they just published 2 years apart, one of them in Nature and one of them in JAMA Network. It was using AI to screen for diabetic retinopathy. Then it became 2018, 2020, more about triaging, more about identifying the ER. And you can see that it started moving from medicine toward the real problems in healthcare and healthcare access and optimization and prioritizing in the emergency room, and where we really have bottlenecks and access to healthcare. And fast forward to 2020, when ChatGPT came like a storm and just broke everything apart. And now we have language models that talk our language, that respond, that quite understand us, that you just need to write plain English and they can respond and understand you. You don't have to code, you don't have to learn programming, you don't have to learn any programming language. You just write whatever you think in the way you want it. You can even do grammatical and spelling mistakes. And it will understand what you want, and it will give you options, and you can respond back. And even now it has a face, it has a voice that very mimics human with different accents. And it's kind of like shifted the mindset, where we used to think when machine is talking, it's like this robotic voice, but now it's like human talking. It's like you cannot differentiate it. And even now, it's even expanding more. It's becoming generative AI, where you can have avatars that kind of look like humans and act like humans. Even their nonverbal cues are more human-like. So this shift happened very quickly since 2020 and now 2025. In 5 years, every month, every week, we're hearing new things. Just 2 days ago, we heard about a Chinese competitor that uses less computing power. So this is like ongoing, and it never stops. And we cannot really ignore it anymore. So if that really did not convince us yet, let's look at the money. So are people really taking it seriously? Are investments going there? Let's look at 2014, which is, we had $600 million in funding for the health AI market, not only AI, so the health AI market. It has $600 million invested in 2014. In less than 10 years, in 2021, this jumped to 6.6 billion. This is according to Accenture. It's a major consulting company, if those who knows consulting company. And this is growing. And the total investments, they kind of go in different places. If you can see the top 10 applications, $40 billion are just going in orthopedic surgery, robotic surgeries, robotics. We want to have more automated robotics do precise medicine. Virtual nursing assistant. The chronic problem of shortages of nurses is a big, big problem that people with funds want to attack, want to address, and want to fund to find a proper solution to. And this took $20 billion of funding. And the list goes on, from administrative workflow assistance to fraud detection. It was very important in the health insurance industry. Dosage error reduction, which was one of the leading causes of death in the US for some time. And clinical trial participant identifier, which is very important for new drugs and new pharmaceutical breakthroughs. And the list also goes on to automated image diagnosis and cybersecurity, which make the total of $150 billion going into health AI. So you want to ignore AI, you're ignoring $150 billion in investments in health AI. Just only health AI. And here, the question, what is the basic requirement of any AI model? What if someone just come from the door, tell me you got $1 billion, a million AI project, and I say I cannot do it if you don't have one thing. Does anyone have the answer? Data. Exactly. It's data. Data. Hello. Okay. Data is like the basic, it's the infrastructure. If you have good data, you have a good model. Bad data, bad model. If you have enough data organized, verified, validated, you will get the best AI model. And then, of course, there's the next step of having good AI literacy, knowing the AI models, how they work and how they do stuff. And then you will do the strategic implementation of the projects you choose to be. And then you will have a good creative community for culture for AI innovations. But data is very important. And who have historically been the experts on data? Okay, disclaimer, that's my opinion, but I think a lot would agree. Who are the historically been the experts? To me, are public health professionals, are the PhDs in public health. For long as I remember, people in public health used to use data. They verify it, they validate it, they organize it. They teach us how to collect it, properly collect it. They also know how to take this data and correlate it with other things to draw statistical models. We used to play with data the way we wanted, with all our research, with all our projects, with everything. And even when I took the course in Harvard, the person who was leading the course was an epidemiologist, associate professor in epidemiology. His name is Andrew Beam. You can look him up. And he used to be the expert in data, of verified data, of validated data, of how to label data, how to categorize data, how to choose the data sets. And this was the prerequisite of any AI model. If you really want to have to compete in AI, if you really want to have to succeed and exceed in AI, you need to have great data. And we have this huge, big advantage being working with data day and night in public health. Okay. Now, let's say the money didn't convince us. The trending didn't convince us. And the importance of AI in the medical field and healthcare did not. Let's think about, and our huge expertise and advantage being public health experts in data. Let's see, can AI really help in changing public health, addressing public health concerns, showing the problems of public health and finding real solution for it? So let me go across a few examples. These are not the only examples, and these examples are not thoroughly thought of in terms of the proper way of ideation, but it's just ideas that are just spread there for people to discuss and debate and get information out of. So for example, early disease detection. This is like the pre-requirement of having proper, that's the primary healthcare, the primary thing. We need, a problem with health is it's not available or accessible everywhere. And usually when someone decides and go to the doctor, a lot of times it's too late. It's in an untreatable stage. If we have mechanisms, instruments using this technology where we can find people who are in the first stages, in the early stages of the disease, this can prevent a lot of problems later on. If you have seen, if you remember the slide about the first publication about diabetic retinopathy, this is like, can be done even by phones, by mobiles, where you can detect the diabetes from the retina. There are even now more studies to detect from a simple retina exam, even cardiological problem. That was, this link is new. And it's not just about detecting things early on. With time, with enough data, with enough time period that will go on, we can detect people that will have a certain disease in few years coming. Imagine that you can know that in 5 years, you might have diabetes, for example. This will make you change and rethink your lifestyle, your decisions, your dietary intake, everything. And if you have a hereditary disease, you can, that might strike you in the future. Also, you can do like planning and maybe treatment, pre-treatment for these kind of things. Here I already jumped on medical diagnostics, but I can go further by telling you that it's where AI is exceeding right now. It's really excelling there because there's enhanced image recognition using AI. Everything diagnostic that requires imaging, that requires having a any kind of photo or image, AI can read it, can scan it quicker and in a very efficient way, and can start to draw correlations, sometimes that were not seen by the historical way of diagnosing things. And this is really helping people to find problems where it's very, very small in a big area of the photo. And this is advancing and revolutionizing radiology, medical imaging, even ophthalmology, skin. And in skin and in dermatology, this can even be done because it's a bigger scale. You don't really need specialized equipment to look into these images. You can just take a picture and put in this in an app or something and get quite efficient or satisfactory result. Personalized medicine, and there's a lot of talk. Probably you've heard of precision medicine, where we start giving a pharmaceutical solution or a medicine that really applies to this specialized, specific individual, where it's really gives the best outcome as per his genes, DNA, and all his genome. We take it a little bit further with personalized medicine, where it actually quantify and try to understand all the different factors that we have data on, from environmental factor, work stressors, everyday stressors, and then the treatment can differ. And this data, the best way to generate this data and to analyze it in an efficient and optimal way is using artificial intelligence. Remote patient monitoring. People with wearables, the mobile, the smartwatches that can measure on constant basis certain things, they are improving. Started with a heartbeat, now we have blood pressure. Soon we will have other things. We have even heard about nervous impulses that can be, and EKGs and ECGs being monitored on constant basis for patients. This can, imagine now if someone went at some point in their life and put a halter on, it's just like measures your heartbeat or your blood pressure for 24 hours. Imagine we can put a halter on everyone. It's just a smartwatch or the mobile, and we can take this data and analyze it. And then in 10 years, we can see that those people who were having these irregular beats or irregular blood pressure at some point, they made us a major problem, healthcare problem, public health problem in 10 years. And then maybe at that point, we should have made the incident and made the implementation and made a project that would help them out. So remote patient monitoring can help in these things. Okay, it's something, Kamen, I was seeing if it's on another category, but I can't talk about it here. It's even people who, we live in a city, AUBMC is here, CMC Hadna, it's amazing. But what about people who, even if they have the ability to pay, they cannot access easily? What about if it's in winter? What about if it's in minus 40 degrees in some places in Siberia? How can really they get this benefit? And that's how now we are able to give things remotely by really using, even internet has now advanced. We have these Starlink connections where you really can get internet without the infrastructure and the fiber optics and everything. So even this is helping a lot in getting these things done. So imagine we're having in a very distant place, rural place, and you can really talk to your doctor or talk to a specialized person having the medical knowledge, or talking to a chatbot that has the medical knowledge that have been monitored and tested and measured and have been really, we have kind of customized the way that the replies are being sent in a very safe and efficient way. And you can get 80% of your medical concerns responded to in a timely manner. Drug discovery, this is a big one. This is a big one. There's a lot of study about how clinical trials and how things can be done and how you monitor people after this medication happened. And people who are aware of that and just see how many recalls happen in the drug industry, even after 15 and 20 years that goes by in testing and FDA approvals, can understand how much important you have to study medication after the fact they are approved, and there are like correlations and things that might happen that you can never predict unless you measure and measure and measure and have the data and have it analyzed in a very efficient way. Emergency response. I think this is very important, especially if we live in this kind of area and region, and if we really are connected to and we have the data, and for example, if there's a problem that's affecting 5 years old and you want to send instructions and you want to send the basic things, you can really stop this from proliferating further at the beginning of the early stages if you have this data and system in place. I'll talk more about this later. So environmental monitoring, and this is very important. We know, we cannot, if we learn something in health sciences, is that we cannot talk about public health without talking about environment. The environmental factors, the pollutants in the air, in our water, everywhere, these things are very much correlated to how our public health will portray. And this is, I don't have the information, but I think it's significantly correlated. People with better environments and better rivers, clean rivers and water, have a better health. And what we can do with satellite images and proper data analysis from an AI module, we can really compare these over the years. We can identify areas where they have above the average problems and really tackle them like really, really early on. If you have a asbestos problem, if you have a pollution problem, you can identify the factory, the pollutant place, make the intervention before 40 years before this generates cancers, before it generates death toll that's big. This is really what public health is about and saving lives. And even on the delivery and health delivery, the vaccination part, we really need to identify, when we give vaccines, we try to identify those populations that are in much need of it. And where we can find people who, for example, polio have to be given in 6 months, and where they are, if with countries that have proper identification, the basic identification of proper birth certification, when people are, the birth rates, they are really certified and they are really registered, we can really get 100% or 90% vaccine implementation rate when we have proper systems, with constant reminders, with constant messages telling them where is the closest place to go to get your vaccine, and what's the price of it, or if it's free, or where they can go, and everything. And it can be institutionalized in a very good way, centralized in a government or a governmental entity, and it can be done very seamlessly. Okay, هلا we did a utopia. It's amazing. We can solve all the problems in public health. But we are health sciences, AUB. We have to think about the ethical consideration and moral obligations. So AI is an amazing transformative tool, very efficient. However, we need to set the ethical and moral grounds for it. And as we said about the importance of data, it's the same thing goes to the how biased is the data, and how ethical and the algorithms that we use the data, that uses the data. So I think, as public health experts are experts on data, they are on ethical considerations while they're taking their projects. And here are a few things I think that we should think about. First, let's see equality. So fairness is a very important thing. And if you take the data that's on whatever inequality is there in the data, it can transform to the AI model. And here we have to be aware of that. And here we have to have intervention. And I'm gonna use this point just to expand a little bit, that the safest place and the best place for people to start engaging in such projects are while they are students in a university, because they have the guidance of the professors, of the people who, and the experts and the expertise who have been working for years and years and can talk about any subject and engage in any subject from the different sides, from different stakeholders' point of view. And one of these factors is the ethical and moral ground. So I think if there's a way where they can start now at the university level to err and to trial and to experiment, it will be the best way to have a competitive edge when they graduate. Another thing is data protection. It's very important. AI just engulfs and swallows a lot of data, patient data. And this data should have, there's a lot of debate there, but it's owned by the patients. And kind of here we have to really be concerned and be very careful to have the anonymity that can guarantee that we will have a great AI model. Transparency. There's a big problem in AI models right now. What we're getting is that we put an algorithm, we give the data to the AI model, and it generates an outcome. In some cases, we don't know how it generated this outcome. We can take the outcome, verify that it's a right outcome, it's a good decision making, but you don't know how it reached this. And this doesn't really, when we are taking important decision making for important policies in the country, it's really important to know that this model have really took all the ethical considerations, everything into place before agreeing on any decisions. And actually now there are companies that they only exist to try to re-engineer the way the AI model thought and brought us this outcome, and try to give us the thought process it went through and the logic, so we agree on it and we decide to go with it. And that's transparency is very important to go with big decisions, especially with AI models for big decisions. Misinformation prevention, and here it's important because AI can amplify any message, being it a false one or the right one. If we are facing a pandemic and we want to send chat boxes, AIs that are personalized to everybody, we have to make sure, if it's already automated, we have to make sure that it sends the right message, because one false message can reach exponentially to a lot of people without proper thought. Global solidarity, it's when we think about global health, there's always this problem where first world countries do their models and we adopt them. And sometimes our local intrinsities are not taken into consideration. This is very important when we take an AI model from outside to customize it and to try to think about how can it affect us locally. Okay, I'll move on since time is, I think I only have about one slide or two slides. Okay, that's it, huh? Okay. Okay. I just want to go from the macro view to the micro view like Lebanon. We know we don't have the $1 billion to invest in AI. We don't even have it to invest in the internet or in electricity. So we might not lead on this. And there are a lot of things that can be an obstacle for a small country like Lebanon when we want to adopt a big technology. However, being a small country has this advantage that we can really provide access. Access to healthcare can be like easily done with AI. And right now, we are having LLMs for free. Although, I don't know if you know that if you do a simple research on ChatGPT, it costs the company around $20,000 in expenses. It's giving us for free. Why? Because it needs the data, it needs the training model, it needs to get engaged, and with DeepSeek, it's getting cheaper, and it will get cheaper. It will kind of optimize to the amount that we need. But this is an advantage that we can use. We can really use this amount of that cheap, free AI model in our hands that can access all the knowledge and do our better policies, reach our goals, set our objectives in a small country like Lebanon. So I've just stated some things that I think can be the priorities for Lebanon if you want to really adopt AI on a grand level. One of the things is disease surveillance. We can really connect everything using automated AI, that they can survey major diseases, important diseases, things that we know that are endemic, if that's the right word, for Lebanon. And we can really concentrate our efforts there, ask for funds in that areas. We can optimize the workforce. We know how, what's a nice word for it? How the public health hospitals are undermined and how they lack resources. They have shortages of personnel, shortages of resources, of equipment. And one of the things AI can do is that it can build you an AI agent that can take sometimes the role of an AI administrator at a certain area, where it can control your expenses, it can control your goals, it can measure properly, and it can dictate the centralized vision of the Ministry of Health or of the governmental entity that wants to build up the public workforce. So that's something that we can really get in a very affordable way when we optimize the workforce and reduce the costs. Predictive analytics, and this is important because when you really do not have a lot of funds and a lot of money to do things, you really want to know what's coming your way. So when you put the budget, it goes in the right place. So AI has a very good predictive rate. They are using it with stocks, they're using it with soccer and betting and everything right now. So we can use it for a good cause in healthcare. Mental health support. We know that probably we are one of the most countries that suffer from mental health. We had, unfortunately, a lot of wars, disasters, all of these things. And I think we can use more resources in mental health. And there were a lot of known examples where we take chatbots, teach them accessible 24 hours, properly trained, properly knowledgeable, that can prevent any unfortunate outcomes from mental health. This is something that's being studied in a lot of first world countries. I think it's very, very important to explore in Lebanon with our big number of mental health problems. Supply chain optimization. This falls in the same category where we can optimize our resources in a way to serve the whole country. Telemedicine access. Right now, we can even generate avatars and the voice of healthcare respondents where they can talk, engage, and tell them their story and give them basic health needs and medical needs. I think this is a ripe place where we can try out these and serve the rural populations and unserved populations. And the crisis response. We really need to pioneer in crisis response because I think every couple of months we'll have a crisis. So we have a good learning curve across better than a lot of other people. So this is a place where we can really use this technology and improve on it. So in summary, in Lebanon, I think if you want to weigh the benefits and the disadvantages of AI and to be utilized today, I think it's a very serious question if to use it now and on a major level and in a centralized way. I think I'm almost done. Just one last questions. What makes us human? Yeah. Yes. True. True. شلتي Karen? We make mistakes, صح? Yeah. Yes, but according to a lot of the internet things that we log on, it's selecting all the images with traffic lights. And that I just put this because we really need to take even this grand technology with a grain of salt. And even the mass information of all the internet that's fed into the ChatGPT is the amount of information that a 5-year-old gathers. And that's without the verbal cues and life experiences that humans experience. And it's still a tool, not something that we can totally rely on. And I think we sometimes historically have mismanaged that thought. We over-rely on technology without critically knowing its disadvantages and how very easily it can go and do something very stupid. So even the intelligence of the AI can sometimes be stupid if not governed by humans and by our expertise and guided by us. I think now it's the time that since AI is here, let's understand it, let's study it, let's play with it, understand exactly how to teach it in a safe way, and engage in projects with it. Exactly. And خلاص. Thank you. Hey.
That's perfect. Okay. So thank you, Mr. Halawy, for this practical and insightful presentation. I'm just going to take the questions from the room as well as from the online. Okay. Oh, no. Sure. Okay, so I'm just gonna, I think this is the first question here. Okay. Uh, all right. Let me see how many questions we have. Okay. Okay, so I'm just going to take this first questions from Amal Karaki. Does Lebanon have the needed infrastructures for an equal AI accessibility and usage?
Okay, this is a great question. We don't have infrastructure for anything, but the good thing, as I mentioned, AI is, we have this golden opportunity where AI is being, we have a lot of platforms that's giving it for free, especially in LLM models. There are even free data sets that are being given to a lot of people where they can go and take this data and do AI models. There are free courses online where people can learn the programming side of AI, the Python programming and a lot of these things. There are even very affordable courses of how to start an AI project on any field. So I think that we may not have the proper infrastructure, the proper funding as a country, but we do have a lot of free resources that are globally given to help in that. So I think we can start, if anyone can start and he wants to engage in this thing, and even without a lot of expectations, this is the time to do that, and there are a lot of free resources to use.
Thank you. Any questions from the room?
Thank you very much for a challenging conversation. I think it's about time that we start thinking about it. In academia, we are faced with a profound question. What are the branches of our specialties and our sciences that are going to become redundant? Okay. And history is full of businesses that have become redundant and then they disappeared. مين بعد في مبيض شيء in Lebanon. ليش بعد عندك طناجر نحاس هنيكي وبهني حالي فيكي. So
endangered.
And it's an endangered species. I love it. So the questions really here are how can we start moving our planning ahead? Thank you. A few years ago, we tried to figure out if we can do a mobile screening for breast cancer in areas that are too far away from mammographies. And it turns out that we cannot, by law, and laws are changeable, but by law, we could not give the results to the person who has come in for the screening, except if there are two signers on it. In the mobile van, we had a radiologist who could sign the first version, but by law, we had to have a second reader, okay? And that means that we need to send back the results to Beirut and then wait for the for the goodwill of that person who normally is a senior person to do that on his or her own time, and then sometimes the results were lost, whereas the lady is still waiting for her results back. So today we can bypass this. The results are there. The reader can read them, and the senior or the AI can read the second thing and give us a reading. It really means that already we have bypassed a human resource thing. But if there was a person there that had this job for a living, we would have killed her life. Okay. We have to make sure we cannot stop AI, but we have to make sure that we have the plan for the shift in human resources and training that will be required as we go through. And that is really what scares me.
Can I ask a question as a reply on your question? Philosophical question. Is it bad to take out redundant positions?
No, especially if we cannot stop it. Okay, yani, if the sun will come out every morning, I can curse it, but it's going to happen. Okay, so all I have to do is.
But we can do it in a responsible way.
We have to protect the people, because we don't want to find ourselves facing the situation of a whole part of the population losing their businesses. That's what's happening in the United States. All these people who are voting for Trump are people who cannot find any more jobs because the industry in which they work have become redundant. They've gone elsewhere. True. And so we cannot afford in a country like ours. We have to take that into account, and I think it should be part of our future thinking.
I think AI is here to complement more than that, to replace. And we have a lot of areas where it's unserved with quality radiologists. That these are the first priority areas that we need to address before actually going to where there are in the cities and the urban areas where this is plenty. And now this will be, I think, in the second stage after we have reached all the unserved areas and rural areas, and giving them this, because people are always searching for cheaper ways to find and screen their radiological, and they will try to replace paying for a radiologist who have studied for plenty of years to do that. And that's why I think the future of even education and medical education will be more thinking about concentrating on the core business and core medicine of really how to better evaluate, how better to look, how better to draw connections, than the technical part where they are just looking at things over and over and trying to detecting and becoming better machines.
So I think to build on Salim's point and yours, Malak, I don't think you're right. It's not to replace, it's to support decision-making, and this is how we need to leverage on it. So when we introduce it as a tool where we redesign medical education, let's say, for physicians to become just totally relying on AI, then we will need to caution you and the health sector and whoever. It is a tool to support decision-making, to improve decision-making, especially in cases of shortages of resources. And it is not, and this is, I think, where we need to caution ourselves on the use of, again, we can take the same example and apply it to education.
Exactly.
Right?
Yeah.
So we can become obsolete.
And that's why it's important for people who have the expertise and feel the social responsibility to be part of these AI modules while they are being built and while they are being structured, to be on the supportive side, not on the profit side and on the commercial side, and just break more money. Because right now the funding is going to companies that can profit. They want their return on investments, and they don't really pay attention to these social important questions. And I think this is the time and this is the place where we can have these debates, we can have these discussions, but let's start talking about AI freely, and it's like something that's happening and as part of science and part of the technological revolution of any discipline. And we can attend these questions early on and maybe find solutions where it's a win-win situation for all the stakeholders.
I'm just going to take two questions here from the online. And Natalie, the question is, what if AI made a diagnosis error? So who is it? And the other question is like, how and who can teach AI to treat images? Should we master a specific language to write a specific algorithm, or the language is already built in and within like different accessible AIs?
So the answer for the first question, yes, AI right now can misdiagnose. They have a good, but actually even humans are misdiagnosing, even the radiologist. And we have ways to measure this. And we are comparing always AI versus a human, and we're seeing who's getting better at that. And actually, and we going back and retraining the AI model to become better, to have a good, acceptable rate. And here also we go back to not total dependence on any technology, being AI or any medical machine. Sometimes it's the medical machine, even misdiagnoses or having errors, and putting measures in place to. There are a lot of places where AI models are there just to monitor other AI models to make sure they're double checking on their work, on their ethical considerations, on their measurability and the accuracy of them and their precision. So this is for the first question. For the second question, how and who can teach AI to treat images should be mastered? And here, okay, to do a perfect or a good AI model, it needs a group of people. It needs a team. There are the programmers, but they are not the main people in any AI model. You know, a lot of people think this is a technology thing, and probably people in tech and people in programming, they are leading on that, but they are just leading on the programming part. And as I said, the most important part is the data. And data is something that we really know here in academia, and we really know here in public health, and we really know as scientists, and we can even lead on that. And you can hire people. If you want to start an AI model, you can hire good programmers that you can dictate them to what to do and what the model wants to do, and that can help. But to the ideation part and the concerns where the public health is in need of an intervention, and how to collect the data, validate it, verify it, correlate it, and what kind of tools you want it can be done by public health professionals.
I'm just going to add a question. I'm just going to I do have a question myself. Do you think that kind of the latest event that happened with the use of AI for the really, the killing of human beings and all this war happening, using the data and abusing that AI, do you think it kind of shook that trust in terms of this technology and the advancement and the trust in the...
It might be. And I think being people who are scientific, we know that every new tool, every new technology has a dark side. I remember, we all remember the story of Thomas Edison when he electrified the elephant, just to show how bad electricity is, just because he wanted to get rid of Westinghouse, his competitor. He wanted to, it was AC against DC, not the band, but electric power. And sometimes, yeah, people electrifying is a way to execute people as well. But can we live without it? Okay, Lebanese maybe, but other people, no. كلنا بنعمل احتفالات once electricity comes. So yes, and it's good to raise this and have this in our mind, especially people who into policy and policy making, because this is important. And if not, we gonna put the safety guards and the guidelines to manage this new technology, then I don't think people who are for-profit commercialized companies will do that.
Thank you for this very enlightening talk. I was just thinking that a couple of decades ago, for the past few decades, we would hear about like the pharmaceutical industry and the questions about their involvement and influence on policy, research, and how they drive the healthcare industry. So I'm just thinking, like, what governing frameworks do we have now for AI in healthcare, and how do we ensure that, I mean, as you said, most companies right now, they're just competing for profit, and it's a race, and every few days we have new developments. How fast can we come up with governing frameworks to ensure that the technology that's coming out is really benefiting everyone on the global health scale, and not they don't have an agenda, an alternate agenda in the background? Thank you.
Okay, I have 30 seconds to respond. So this is exactly what's happening with every new technology. We're taking the same problems and amplifying them with a new technology. And that's where I think we shouldn't adopt a new technology late, especially we are the most people who are concerned about it's called public health, about public health, about social concerns, about social problems. And if we really study it, embrace it, and know AI from now, we can really lobby for it. And we have learned in public health how we lobby and how we get all the information from different stakeholders and how to the policy making of proper and right policies to use any new technology. And this is, I think, exactly the place where this debate and discussion and effort should be done in the Faculty of Health Sciences by public health professionals, by the professors, where we can take this new technology that's double-edged sword and try to use it in a safe, responsible, ethical, moral way.
Thank you so much. Thank you, everyone, for joining us. And thank you so much, Mr.
Thank you all for
your
attending.
presentation.
Thanks.
Thank you. We'll see you next week. Bye.